Hello, how are you? Many people suffer from varicose veins in their legs. Varicose veins are those spider webs that appear on our legs, those veins that may or may not be a bit more swollen but have a different color. For some people, they can be greenish, bluish, or even slightly purplish. And many people think, oh, it's fine, I don't care about varicose veins, they're just a cosmetic issue anyway. I'll solve this problem by wearing long pants or by wearing a long skirt. I don't have time to worry about varicose veins right now. What many people don't know is that varicose veins are related to circulatory problems in many cases. And this circulatory problem, when not treated as it should be in the medium and long term, can lead to leg ulcers, thrombosis, and even pulmonary embolism in more severe cases. So it's very important not to ignore the issue of varicose veins and to seek treatment and prevention. There are some tips I'm going to share with you today regarding lifestyle, diet, and even supplementation that can make a big difference for your varicose veins. You're going to love this video, so stay until the end because you won't want to miss it. Before we start, I want to ask you, do you have varicose veins? Do you feel any kind of pain, heaviness in your legs, burning or stinging in your legs because of varicose veins? Or do your varicose veins bother you more for aesthetic reasons? Or maybe you have varicose veins, but you don't feel anything, you're not bothered by their appearance, and you're living well with them. How does that work for you? Write to me down below in the comments. If you can, go ahead and like the video. This is super important to me. It shows YouTube that you like the channel and that you trust my content. For us to better understand why varicose veins happen, we need to know a little bit about how our body's circulatory system works. The heart pumps blood through the arteries toward the extremities, and then the veins bring that blood back to the heart. Together, they are responsible for making the return circulation happen. As I told you, the arteries benefit from the heart because with its contraction, it pumps the blood. But unfortunately, we don't have a heart at the tip of our toes or fingers. So it's important to have a good structure in your blood vessels so that they, the veins, can contract, close the little valves inside them, and improve this return circulation. Especially in the legs, this is made more difficult by the effect of gravity itself. So, many people who have difficulty with the structure of their veins have trouble with venous return. Venous return, fluid buildup, blood pooling, so to speak, and this ends up contributing to the appearance of varicose veins. Actually, there are two natural aids our body has to improve this, even though we don't have a heart at the tip of our toes. We have first the calf muscles, which act as a natural pump because every step we take helps push the blood back up and aids venous return. And then there are the venous valves, which I mentioned before. They're like little doors inside the veins that prevent the blood from flowing back down, right? They make the blood keep moving upward as if they were compartments that close off and hold the blood higher up. When these valves in the vein become weak, and this can happen due to genetics, due to a sedentary lifestyle, constipation, being overweight, or if you spend many hours a day standing or sitting still in the same position. The blood starts to accumulate there, and as it builds up, there's more blood than there should be. The veins dilate, lose elasticity, and can become visible under the skin. That's what we call chronic venous insufficiency and also varicose veins. There are some factors that can contribute to the development of varicose veins, and in women this is more pronounced because of hormones. Estrogen and progesterone relax the walls of the blood vessels, so there's a greater tendency for the vessels to become looser, so to speak, and for more blood to accumulate there. Especially during pregnancy, when a woman uses birth control, and during menopause, right? Because collagen naturally decreases. Of course, this can also happen in men, but I'm just explaining why varicose veins end up being more common in women. Our bodies start to feel some differences when you begin to have this chronic venous insufficiency, and often even before varicose veins actually appear. So, it's good to pay attention to the signs your body gives you that something is changing. The first thing is the feeling of heaviness and burning in your legs. Have you ever felt that? Many people, before they get varicose veins or at the beginning of this condition, feel this a lot. This ends up being overlooked. And people think, I walked a lot today, I spent a long time standing, or on the other hand, I worked sitting down all day. But it's a sign that your venous circulation isn't working so well. Swelling in the ankles is another sign. This shows that there is a greater accumulation of blood and fluids in the lower part, and it may be related to this chronic venous insufficiency. Nighttime cramps are often not due to a lack of potassium, but rather because of the muscular effort needed to pump the blood. To make it easier for the blood to return, itching and dark spots near the ankles can also occur. It could be from the iron in hemoglobin, which leaks out, becomes highly concentrated there, and stains the skin. And in advanced cases, where varicose veins have usually already appeared, wounds that do not heal, called venous ulcers, are related to this inability of the blood to flow and circulate as it should. So, these are signs our body gives us that circulation is not working as well as it should. It's important that we try to change this, isn't it? As I told you, when we don't control varicose veins, it's not just the aesthetic aspect that concerns us, it's mainly a health issue. So, I've put together some tips here on diet, lifestyle, and even supplements that you can add to your routine to help with varicose veins. As we've already noticed here, one of the biggest culprits when it comes to varicose veins is inflammation of the endothelium, the vessel wall, right? Because if the vessel wall is more inflamed, it loses some of its elasticity, and those little valves don't work as well as they should, what increases inflammation in our bodies. I've talked about this in some videos before, but it's always worth repeating. Diets high in sugar, fat, trans fats, saturated fats, and ultra-processed foods cause the release of inflammatory substances in our bodies, which hinder blood flow and damage the vessel walls. But there are nutrients, on the other hand, that can strengthen the veins and improve blood circulation. When we think about improving our veins, improving the elasticity of blood vessels, I immediately think of collagen. And what helps boost your body's collagen production? It's vitamin C and quercetin, which is also a bioflavonoid found in onions, for example, or even rutin. These reinforce collagen and reduce capillary permeability so that less blood, in quotes, leaks out into your leg. There's also the matter of omega-3 and magnesium, which reduce inflammation and relax the walls of the blood vessels. So, omega-3 is found in fatty, deep-water fish like sardines and tuna, as well as in chia and flaxseed. It's really present in these anti-inflammatory foods. These are foods we consume more frequently in our daily lives, and magnesium is found in pumpkin seeds, dark chocolate, and whole grains. There are also two nutrients closely related to vascular health, resveratrol, which comes from grapes, and curcumin, which comes from turmeric. They are powerful antioxidants that protect the endothelium. The endothelium is the lining of the blood vessels. And of course, fiber and water. As I mentioned, varicose veins are often related to constipation, and these fibers and water are essential for maintaining good intestinal transit, reducing pressure in the pelvic veins, and improving blood flow throughout this lower part of our body. Here's a golden tip that will really help you. If you suffer from varicose veins, it's important to move your legs. As I mentioned, of course, in many cases, it can be related to genetics. But the vast majority of people who suffer from varicose veins are those who either work long hours sitting down, or people who are very sedentary, or even those who spend many hours standing, but always in the same position. For example, people who work in stores, who spend many hours standing, just standing still. So this is very complicated because when you manage to stimulate the calf muscles, as I mentioned, and the other muscles in your legs as well, you actually make this return circulation easier. I even have a video here on the channel talking about how the calf is our second heart and how to activate it the right way. I'll leave that video in the description for you. But ideally, you should be a more active person. Walking, swimming, cycling, going up and down stairs, doing things around the house, trying to park farther away so you walk more. Staying more active will already help you, and at least 20 minutes a day activating those calf muscles will benefit you. So, what you can do in short intervals throughout the day is, for example, stand on your tiptoes on the balls of your feet, up and down, standing on your tiptoes and lowering your heels 10 times. You do this every hour 10 times. And if you're working standing up, just do it there, discreetly. Or if you work sitting down, stand up and do it for a bit. Flexing your ankles is also important, right? Move your feet back and forth and try to avoid crossing your legs. Some people sit with their legs crossed or put one leg under the other. This impairs blood flow and is very problematic. If you can, when you get home, elevate your legs for 10 to 15 minutes. That will also help a lot. By taking advantage of gravity, swelling is reduced and venous return improves immediately. And avoid wearing very tight clothing around the waist area. And high-heeled shoes, which interfere with calf muscle contraction, right? They also interfere with proper walking and with the correct positioning of the foot as it should be. So one option could be to use compression stockings. If you're unsure which one to use, you can ask your doctor because there are different levels of compression that can be used for specific conditions. If you have any cardiovascular problems, when in doubt, it's very important that you talk to your doctor first to check whether it's recommended for you or not, and to determine the best level of compression in your case. There's also the matter of nutraceuticals, the supplements I mentioned to you, right? I've already made an entire video here talking more about horse chestnut because it's very rich in ASN, which improves venous tone and reduces swelling. There's Gotu Kola, which stimulates collagen and improves capillary circulation. There's also rosemary and witch hazel, which have anti-inflammatory and astringent properties. So, there are several supplements you can also use as a complement to help with varicose veins. But, as I mentioned before, there's no point in taking a supplement and expecting it to work miracles. There's no point in taking a supplement if you eat a lot of sugar, which breaks down collagen, lots of inflammatory fats, and if you're very sedentary, So it's really a combination of things that will help you. It's also important that you get an accurate diagnosis of the type of varicose veins you have, whether it's something more serious or not, and whether there's a treatment you can do or not. So remember, this video is for informational purposes only. If you have any questions, talk to your doctor who follows you in your city. Tell me what you've been doing to improve your varicose veins and what you're going to start doing today. I'd love to see your comment. Please like the video, it really helps me out, and share it with anyone who might enjoy it or needs it. Let's work together to expand this chain of kindness. That's what I want here with the channel. See you next time. Bye.